Thank you to the members who brought the motion, the amendment, and indeed to everyone who spoke. This is not just important. We should be really passionate about this issue. So I welcome the opportunity. What I want to do is outline for you the current position on waiting times, the actions taken and the actions ongoing to address the issues, including service transformation, of course, the importance of an appropriately qualified and structured workforce, the complexities of working within a highly financially constrained and challenging environment, and critically, what we need to do going forward to ensure we can deliver effective and sustainable health and social care services for all. And can I say from the outset, I fully acknowledge that the people of Northern Ireland are not receiving the care they deserve on a timely and an effective basis. Far too many people are waiting far too long. It is quite simply unacceptable that our waiting times are lagging so far behind the rest of the United Kingdom, and it is incumbent upon me and collectively upon all of us to ensure we're doing everything within our power to address that. Principal Deputy Speaker, I don't intend to rehearse at length my position on the budget, but suffice to say, the budget has imposed severe pressures on all parts of health and social care. And you don't have to take my word for it. The programme for government, the draft, approved by all executive parties, explicitly states, and I quote, "It will not be possible to reduce our lengthy waiting times within the funding currently available." I welcome that candour and the de facto acknowledgement that the health budget passed by this Assembly is entirely inadequate. My immediate predecessor as Health Minister remarked previously on the irony of members repeatedly demanding more health investment, having voted for that budget. And I won't labour the point, but the irony klaxon has been sounding quite a bit in this debate. Can you really demand more health spending when you personally endorsed a budget that gave health less than it spent last year? Now, we're all aware elective care waiting times in Northern Ireland have significantly increased in recent years, and I have been clear this is entirely unacceptable. There are many factors contributing to this, not least the overall financially constrained environment, but also the scale of the gap between funded health service capacity and patient demand, and the residual effects of the impact of COVID-19, which had a devastatingly disruptive impact on our health and social care system. So, in that context, I'm very mindful of the fact there's been a rise in the number of people waiting for a first consultant-led outpatient appointment within the Northern, the Western and the Southern Trusts at the end of June. And while I don't want to bombard members with figures, I believe it's important to be clear about the full extent of the problem. So I'll draw on the March 2024 statistics that include 4 out of 5 of our geographic trusts. So at the end of March 2024, there were 356,000 patients waiting for a first consultant-led outpatient appointment. 95,000 patients were waiting for inpatient or daycare treatment, and just under 165,000 patients were waiting for a diagnostic test. Of the total number waiting, almost 50,000 patients were waiting longer than 52 weeks for treatment. These are eye-watering and frankly wholly unacceptable figures for a population of our size. In addition to the growing backlog of patients waiting, new patients do of course continue to be added, and inevitably the gap between demand and capacity exacerbates the problem and waiting lists continue to grow. So whilst I recognise fully the severity of the situation and do not want to understate this in any way, I'm encouraged to note that in overall terms we are beginning to see small but tangible improvements to the waiting list position. At the end of March, there was a reduction in the numbers waiting for inpatient stroke day case treatment for the 7th consecutive quarter, with a 14.3% decrease in the numbers waiting since the same month last year. And while this is good news, it's only beginning to scratch the surface of the problem. These figures, of course, aren't just numbers on a page. They represent individuals, family members, friends, who are often waiting in pain for life-enhancing, life-changing or life-liberating treatments. And it's understandable that there is a sense of urgency about this and also a sense of frustration, deep frustration. But the reality is that the health and social care system is hugely complex, consisting of a wide range of varied and interdependent elements. Members will be aware that in May of this year my department published an updated elective care framework plan. This framework built upon the lessons learned from the first framework published in 2022. It sets out a clear plan to address waiting times, with a focus on areas where the impact would be the greatest. For example, areas where there are a high volume of patients waiting on treatments that are non-complex. And I'm fully committed to delivering that plan and building on the good work that's already being done across health and social care. It's important that I make it clear, however, that delivering on that plan will require sustained investment. And the scope to do this has been severely hampered by the belt-tightening constraint of the current financial environment. As always, we strive to do what we can within the limited resources we have, and since publication of the initial framework in June of 2022, we've seen the successful implementation of a number of initiatives which have led to benefits for patients and, as I mentioned earlier, the small start, but tangible start to improvements in waiting lists. Notable achievements include 2 dedicated day procedure centres at Lagan Valley and Omagh hospitals, elective overnight stay centres at Daisy Hill, Mater and South West acute hospitals, the introduction of medical clinics to maximise patient throughput, the expansion of post-anaesthetic care unit beds across the region, an orthopaedic hub at Musgrave Park Hospital, 2 rapid diagnostic centres and a programme of outpatient modernisation. It's important we acknowledge and build on these improvements to ensure this momentum is not just maintained but increased. It will only be through a continuous and sustained focus on ensuring effective implementation of all these arrangements that improvements will be secured. But these alone will not address the backlog, and we need immediate and sustained investment in securing additional capacity in the short to medium term. The reality is that improved outcomes will only be achieved with significant recurrent investment to transform the delivery of elective care on a sustainable basis and address that demand capacity gap. Although the current financial position is extremely challenging, we must continue to do whatever we can within the budget available to improve the waiting list position.
Thank you, Principal Deputy Speaker. Thank the Minister for giving way. He did mention the South West Acute Hospital there, which has the facilities actually to develop further and help decrease those waiting lists, and will he ensure that it's utilised to its full potential in any future plans?
Thank the member for his comment, and I can certainly assure you that will indeed happen. Mrs McAllister talked about the plan for hospital reconfiguration. It is at pre-consultation at the moment. I have asked officials if it would be possible to bring that plan to this House as early as Monday week, and I await their response on that. I'm certainly keen to do it as soon as possible, and I can assure the member that the reconfiguration will be clinically led in terms of its assessment. Now, in tabling this motion, the members asked that I work with executive colleagues to make the case for additional funding for Treasury. And I can tell the House that I have made this point to the Secretary of State for Northern Ireland, the Secretary of State for Health and Social Care in London, and the Prime Minister himself, that mental health, poor mental health and well-being, is a legacy issue of our conflict, and therefore, should the government in London decide to invest in tackling that issue here, there's no repercussive effect for England, for Scotland, or for Wales. It is only a population health issue here in Northern Ireland. So please be assured I'm fully committed to making the case for additional funding. 76 million has been referenced, has been invested this year for waiting lists. It matches the additional investment of last year, but it is significantly less than what is required. It will be used for those with red flag or time-critical waits, that is, those with cancer or with life, limb or sight-threatening issues. But the bottom line is 76 million is not sufficient to do any additional work on those waiting for long periods of time. It will simply help us to stand still. So we need a long-term, collective effort with sustained and substantial investment through multi-year budgets, workforce development and system-wide transformation. And I know Mrs McAllister mentioned multi-year budgets. It is my expectation that when we get to financial year 2026-27, we will finally reach that point where we have a multi-year budget, which itself will be transformational for the delivery of public services. My department estimates that in addition to the 76 million I referred to, there's a further requirement for 80 million per year to support elective care and to reduce the demand/capacity gap, and another 135 million per year for up to 5 years to remove the waiting list backlog, as well as investment across diagnostics, imaging and pathology. Members will recall my department submitted a bid for some or all of that 135 million earlier this year. That included a reinstatement of a form of the cross-border reimbursement scheme, something I'm regularly urged to do, but in the end, not a single penny of that bid was met. The irony klaxon sounds daily in departmental headquarters. In terms of staff, the importance of an appropriately qualified, well-equipped and fit-for-purpose workforce to underpin all aspects of continuity and change in service delivery cannot be overstated. This is not just about numbers, it's about different ways of working to get the best services for patients from all available resources, and having the right staff with the right skills in the right place at the right time. Work continues across the system to stabilise, expand and develop the workforce and to support more effective use of staff across different specialties. However, progress in these areas has been hampered not only by the continuing pressure on the service, but by the current uncertainty about funding. And we used to worry about losing staff to Australia. Today we worry about losing staff to Athlone. Turning to transformation, the Ocean Table today stressed the importance of the need for support for the full and timely implementation of the Systems Not Structures report by Professor Rafael Bengoa in order to deliver a more effective, efficient and responsive health service. One of my first actions as Minister was to meet the Professor over a Zoom call and to ask him if he would travel back to Northern Ireland for one day. Not to rewrite his report, but to reboot and remind us and share his impression of the positive international initiatives that have occurred in the last 8 years. And I hope the whole of the Northern Ireland Executive will again meet and endorse the Professor's views when he is here on the 9th of October. What I expect is that he will acknowledge what we have done and that the report has not gathered dust on the shelf, and I refer to some of the advances I mentioned earlier. My key areas of focus for the next 3 years include delivering reform, tackling waiting lists, improving cancer services, addressing mental health and confronting persistent health inequalities. This is where we deliver better outcomes, saving money, saving the health and social care system and saving lives. I will shortly be launching a public consultation on that hospital reconfiguration framework towards a Northern Ireland hospital network. I understand, Principal Deputy Speaker, that like politics, all healthcare delivery is local. But healthcare has made magnificent advances, and it seems to me if I need a procedure that my local facility delivers once a day, or I can travel a lot further to a facility that does it 10 times a day, 5 days a week, I know where I want to go for that procedure. But to be honest, I think we have to acknowledge that when it comes to community consultation, co-design, co-production, when it comes to MLA's natural desire to preserve and promote local services, and when it comes to clinical advice, there is a tension. And I think we have to acknowledge that tension and work to overcome it. So as I close, if it's brief.
Given way, but on that point I think it is very important because proper consultation and engagement is vital to bringing communities with us. And if people understand what to expect and what the outcome will be, they're more likely to appreciate the reason for change. So would the Minister agree that given this recent visit to DCC Health Futures Group and seeing the impact of that proper co-design, that it is very valuable?
I agree with the member. I'm simply acknowledging that it is something that needs to be worked through, but I am very heartened by the tone of this debate and look forward to working with members over the next 3 years to deliver better outcomes.
Thank you, Minister. So the Business Committee has arranged to meet at 1 o'clock today, and I propose therefore, by leave of the Assembly, suspend the sit until 2. This debate will continue